Hi, I'm Dr. Srinivasa Prasad, consultant cardiologist at Aster RV Hospital, JP Nagar, Bangalore. Whenever we see a patient and their relatives, they do come up with a lot of questionnaires and often these are quite repetitive. So I would want to address certain of these questions in this videos so that these can be informative to all the patients and their relatives. So the first question is, whenever we advise somebody for an angiogram or an angioplasty, they would ask like, what is this angiogram, what is this angioplasty, and how it is done, is it safe enough, and so. So angiogram is generally a diagnostic procedure and it's usually done either through the wrist or through the groin. Most commonly all of us do through the wrist, and only occasionally when it is not possible through the wrist, we would do it through the groin. And it is usually a daycare procedure wherein the patient would come into the hospital after having a light breakfast in the early morning, get the procedure after an hour or so after the routine blood test, and leave the hospital after 3 hours of observation. So angiogram procedure per se would take only 2 to 3 minutes and not more than that. So what we do is we would pass a small hypotube called as catheter through the wrist artery, which is traversed across the artery and brought to the heart, where we selectively cannulate these coronary arteries. There are generally 3 coronary arteries for any given heart or any human being. And we try to inject a small amount of a dye, generally around 3 to 5 ml of dye into these coronary arteries, and to delineate if there is any blocks. If there are blocks, then we would quantify them into critical versus non-critical blocks. Any critical blocks has to be addressed by either a angioplasty or by a bypass surgery. So how do we decide between angioplasty and a bypass surgery? If at all, if the person has a single lesion which is critical enough to be addressed, then it is generally angioplasty is advised. However, if there are multiple blocks or blocks at a complex junction like a bifurcation or in the main artery per se, then bypass surgery is generally preferred. Of course, we can also do a stenting in those places also, but preference as per the scientific evidence would be bypass surgery. What is angioplasty? So it's a kind of an extension of an angiogram procedure. It may not be done always after an angiogram. Generally, we try to plan out the things and try to do it later on. Of course, people also do it as an ad hoc procedure, wherein if at all if the blocks have been thought about previously and the patient is willing to undergo a therapeutic procedure, that is angioplasty in the same table on the same time, we can also do that. So through this catheter, whatever which has been placed near the coronary artery, we would pass a small wire across the lesion and track a small balloon across this lesion and inflate it so as to tackle the blocks. When the block has been slightly opened up, we place a stent basically to scaffold that area so that the restenosis part does not occur commonly. Post-angioplasty, generally patients are observed one day in ICU and the next day they'll be shifted to the ward. And if things are fine, they'll be discharged on either a second day or a third day depending on the patient's condition. So this I'm talking about the elective procedures. So post-angioplasty, there are a lot of patients and a lot of queries which generally patients and relatives keep asking. So one, they would ask us like when to resume the activities. Then there are questions about the diets and other things. Let me answer them in brief. So generally, healthy diet is what we encourage. We would advise them to cut down on sugars and salts and eat a healthy food which is rich in vegetables, fruits, and so on. The most important instruction would be not to stop medicines which have been prescribed by the cardiologist, particularly so the blood thinner, because stent is a foreign body to your body. Until that gets accepted by the body and does not have an increased incidence of thrombus, we would want some blood thinner to be active. Generally, a layer of tissue would develop over that stent and that would take some time. We don't want that layer of tissue to develop in a very faster rate or in a huge manner, but we want that layer to be there so that it does not interfere with the blood flow and form a clot over there. So to this, so we would give a powerful blood thinning agents generally for 1 year. Sometimes we do keep it for a shorter duration also depending on the patient profile. Second is activity. Generally, person is advised to take some rest for 3 to 4 days after an angioplasty. following which he can resume his activity if at all if it is done an elective procedure. So we would also call them for a follow-up after a week, and at that time we would assess his functional status, ECG and a cardiac status by examination, and then further instruction would be given. If at all if the angioplasty is done for a person who had an heart attack and this was done as a bailout procedure as a treatment for an heart attack, then we would advise some rest or restricted activity for 1 week, and at the end of 1 week we would again assess their functional activities and then would advise them accordingly. Most of the patients would be able to resume their activities by 2 weeks. However, certain patients with a severe damage or a large myocardial infarction or a bigger heart attack, so may have to wait for some more time.